Joining us now is Marran. She is the president and COO of Butler Hospital. She recently had some issues with her shoulder and is doing much better now. Mary, thanks for joining us.
Oh, I'm happy to.
So let's start at the very beginning. You were experiencing some trouble with your shoulder. Can you tell us what that was, what was happening?
Sure. So actually, for longer than I like to admit, I'm a swimmer. So I was experiencing pain in my shoulder, and it got to the point where well before the pandemic, I had to stop swimming. It was just, too uncomfortable. And I really do enjoy swimming, but at the time it was like, oh, this is just, too much. I stopped swimming. In my head, I said, oh, you really should get that looked at. I saw my own PCP at one point, and she's like, why don't you go get that looked at? And, of course, put it off. It didn't, stopping swimming didn't really make it feel any better. There were just movements I couldn't do. And, at times pain and achiness that, was unpleasant, but as I can do sometimes, I procrastinated, didn't really do anything about it. With the pandemic, and I'm on the group that's working on bringing patients back, it seemed to me the smart thing to do would be to use the wonderful resources we have here at Care New England and get somebody to look at this thing. So I did.
Right. So you told me that you went to Kent Ortho at Kent Hospital.
Yep.
And what did they do? What did they find? And how did, did what happened to your shoulder happen?
Sure. So first, let me say the scheduling of the appointment, super easy. I went online, I self-scheduled, I got my appointment at Kent, arrived for my appointment, quickly, seen, I was screened, for symptoms of the virus, place was spotless, I was completely comfortable and felt safe in seeking that care in the context of the COVID-19 pandemic. Then I saw Dr. Cormier, who his specialty is sports medicine. So he evaluated my shoulder. In fact, as much as it's hard to admit that some of it is because, I'm getting older, and the repetitive, motion of swimming and pulling through the water, I've shredded some things in there that, now need to heal. And there's work that it looks like I can do to build motion and strength that will let me avoid hopefully injections or surgery. So Dr. Cormier, who is a sports medicine guy, he took plenty of time to sort of give me the image of what's going on in my shoulder. And then to what appeals to me is that we're not going right away to any kind of invasive, procedure. They took an x-ray, before I even sat down with him, x-ray technicians, lovely. And then what we decided is a path of physical therapy that is likely to allow me to avoid anything, more invasive as we move forward. And he promised me that I'm going to get back in the pool, which is, once I can get back in the pool with the pandemic, I'll be able to get back in the pool. So that's really
great news.
Yeah.
Were you hesitant at all to go into the hospital being concerned about COVID, or did the benefits of wellness far outweigh any potential risk?
For me, I'm someone who believes that if we listen to what we're being told, we mask, we don't go places if we're not feeling well. That if the practices do what they need to do, which they do, they screen for, they not only when you get there, they ask you and check to be sure you're not experiencing any likely symptoms of the virus. You get a reminder that, a phone call that tells you, let us know, don't come if you're not feeling well, and we'll reschedule. So, I'm personally not anxious about the virus. For me, it was, it was an opportunity for me to kind of jump in and have access to care at a time when people are reluctant. So part of what I said was, let me share my experience because one, it's been so far really quite wonderful. And two, everywhere I've been, be it the pavilion, and now I'm getting physical therapy over at the medical group building here at Butler. And, it's clean. I feel confident that, in terms of the virus, I'm not at any greater risk there than I am, anywhere else that I go. I mask, everybody there's masked. There's, reminders to distance. The waiting rooms are set up so that you're not near other patients. There's plenty of disinfectant. And so that doesn't, was never part of my what was preventing me. It was really my procrastination.
Right.
And this was an opportunity to access care and share that experience.
Now, you mentioned you're undergoing physical therapy on the Butler Hospital campus where
Yep.
Kent Ortho is located at the base of the driveway. It's pretty convenient for you being the president of Butler and you have this operation here right on campus. How is physical therapy going?
Great. And again, the one thing I got to say is that super timely. I haven't waited more than maybe 2 to 3 minutes to, upon my scheduled arrival. I work with Kara and Amy. Kara's the physical therapist. Amy is the physical therapy assistant. Depending on what needs to be done, I see one or the other. So to that end, they've been great. They're so pleasant, and it's a pleasure to go. I usually go first thing in the morning before I even start my day. So they're open at 7. So I can get that meeting in, that appointment in. It's about half hour, 40 minutes. And it's been great. And quite frankly, the exercises they have me doing, I have less pain and more movement already. It's only been a couple weeks. So really nice experience.
Well, we're really happy to hear all of this and especially happy to see that you're doing well and you feel healthy and safe.
Right.
Mary Marran, President and COO of Butler Hospital. Thanks for sharing your patient experience with us.
Quite welcome. I encourage people to consider this because it's so convenient and really high quality, expert care. So folks should take advantage of that.